Hey guys, this is Dr. Ty here. I want to do a quick video. I had a patient come in yesterday. She is a 77-year-old female. She has had multiple fusions in the cervical and in the lumbar spine, as well as the thoracic. She had those in the past, I believe, 5 to 7 years. She is diabetic. She has been diabetic for about that same amount of time as well too, and came into my office yesterday suffering of tremendous pain in her feet and her legs, balance issues, numbness and tingling in her hands, burning sensations, pain in the neck and in the lumbar, even after the surgeries and the fusions. And one of the things that we kind of got out of the conversation is just how bad her body is functioning, how her systems are just not firing to where she's having all kinds of issues with sleeping, with walking, with balance, with just every part of her quality of life. And when you look at her, you would think that she should be somebody that's healthy because she's happy. And until we started talking about the issue, and what I started finding out was she was in a depressive state. I mean, she was on so much pain medication. She was on pain patches. She was on tramadol. She's been on morphine. She's been on Celebrex. She's on gabapentin. I mean, you literally name the medication and she's on it. And I thought to myself, man, is this any way to live? And, I asked myself, well, what is it that she wants? When we started talking, she was concerned about where her life was heading. What is in store for her, because she knew in the next 7 to 10 years, if not sooner, she would be in a wheelchair, and she was already walking with a cane. And really, in my estimation, it's probably 1 to 3 years away from being in a wheelchair. Her gait was severely diminished. You could see atrophy and the weakness of the legs. She just had zero balance. Those nerves were not firing the muscles like they're supposed to, and the end result is a complete failure. So when we evaluated her, I saw that she was severely impaired as far as nerve function. Going through her tests, she couldn't feel very much at all. There was just a lot going on there. Through the whole process, though, I did see some clues that the environment where those nerves were malfunctioning still could be changed. So there was actually a glimmer of hope for her. The biggest hurdle for her was trying to figure out, does she do something for herself? Which was really interesting. She doesn't realize that she is now and will be more of a burden on her family than she ever will be. But that was her concern, is that she didn't want to bother her husband and having to take her here and everything else. But when it came down to it, all her husband wanted to do was get her to feel better and help improve her quality of life so they can enjoy the rest of their life together. Unfortunately, from our perspective, she'll never be free of all the pain and problems. But man, if I can get her to do what we need her to do, she could be a good percentage better, to where even 30-40% change will affect her life in such a positive way. So I'm really hoping and praying that she's compliant. She's already made the commitment to get help. And, we can't wait to dive into her case. We're going to have her on a plant-based diet for the next few weeks here to decrease inflammation levels, and then start implementing our intracellular nerve process that I've created. So we're going to start working on that, and then having her start doing some things to help increase circulation at home, working on helping her decrease and just increase circulation naturally at home with diet and nutrition. So there's going to be a lot of things that we do, but the biggest thing is that she was, once she got to that point where she realized that she's going to be a burden on everyone else around her, that it's a whole different story now. So, I'm hoping and praying that she stays focused and does what she needs. And this is really with all neuropathy patients, because I know what it's going to look like in the near future if you don't get help. So it's really important to stay focused and do what you need to do. And let's make a difference in your life. So hopefully that helps motivate somebody out there to make a change. And things are never too late. You just have to look at things from a different perspective. And I hope you guys are being safe out there, and have a great day. Okay, God bless. Dr. Ty out.